Hi everyone, my name is Nikhil, and I worked alongside Dr. Christina Silcox this summer to conduct a basic landscape review and kind of explore the entities that are addressing the policy challenges facing AI in healthcare. So just for some basic background and context, AI right now is changing the way that healthcare providers and clinicians interact with data and make decisions. So just as a basic definition to start us off, AI is any kind of technology that tries to mimic human intelligence. And what we're seeing right now within healthcare is that a lot of the technology that implements AI falls under this general classification of clinical decision support software, or CDS for short. And what this is any kind of software that takes patient data and provides clinicians or doctors with some kind of recommendation or prediction as it relates to a diagnosis or a treatment pathway. So a great example of this currently being implemented is a technology known as IDXDR, which is currently the only FDA-cleared AI system that can automatically predict the presence or lack of diabetic retinopathy within patients. And what it does is it takes this patient data in the form of retinal scans, and you can see a picture of this in the bottom left corner, and it provides a prediction as to whether that individual has or lacks diabetic retinopathy. Another great example of a CDS being implemented is technology released by ADOC recently that flags large vessel occlusions, or LVOs, within CTA scans of stroke patients. And with this background, just to summarize what the project I conducted this summer is we were taking a look at the major organizations that were conducting and funding AI-based policy research within the healthcare field. And the primary deliverable was to create some kind of database that had contact info, links, resources, and any kind of research pertaining to this area. As well, the second deliverable I had was just generally supporting the AI team and helping organize a workshop we had earlier this week and copying and editing papers and updating slideshows. But I'll be focusing mostly on the primary deliverable. So the methods that we use is we did a very basic literature review, and we developed some unique search terms from the AI white paper that the Margolis Center released in 2019, as well as some preliminary readings. And what we did was we used these search terms to find papers using common search engines like Google Scholar. And these papers we were trying to find papers that were targeting identified challenge areas facing AI. So we weren't looking for broad AI papers within healthcare, but that were specifically targeting challenge areas. And this made it raise the question, what are those challenge areas that we're addressing? And we found 7 main areas that we wanted to look for papers in. Those were liability, explainability, regulation, coverage and payment, model bias, privacy, and scaling. And just to give a brief idea of what these areas are, I can just cover a couple of them. One of them, for example, in liability, is discussing in the case of a misdiagnosis or some kind of issue arises, what kind of liability can AI be subject to and who's really at fault in a situation like that. And model bias might talk about knowing that AI can have bias introduced into the system as it's being used. How can we ensure that bias is not introduced or perpetuated as the AI is being implemented in a clinical setting? So we addressed a number of challenge areas when looking for papers. And some of the results were that most of the papers that we found came from academia. And we did find papers that were released by government organizations, nonprofits, or for-profit, but most were from academia. More interestingly was that out of all the papers we cataloged that were targeting the specific challenge areas, both AI liability and model bias, the two I just covered, had the highest number of papers identified. Conversely, we saw that coverage and payment, privacy, and implementation as well had the fewest number of papers. And some of the rationale we can make for seeing liability and model bias having more papers is that these are two fields that were not necessarily specific to healthcare, but falling into other areas like law and public policy. So we saw a lot of law schools doing work in this area. But in contrast, coverage and payment, privacy, and implementation had a fewer number of papers. And this could be due to the fact that a lot of papers were finding generally just AI, but there weren't many talking about the nuances and details involved in actually implementing it. So it was hard to find papers addressing these areas. And then finally, we identified a number of funding organizations that were creating initiatives supporting AI work. So for example, the Pew Research Center had a specific initiative that was addressing AI's use in everyday life. It was called the Pew Internet and American Life Project. And then finally, we identified a new challenge area that could be addressed moving forward, which is the behavioral implications of AI use. So knowing that over time as AI and humans interact in a clinical setting, we can see symptoms like alert fatigue, which is a desensitization to alerts when given over and over again. So we want to understand what the short and long-term effects of this is and how we can account for this moving forward. That being said, I hope that identifying some of these challenge areas that need to be addressed in the future can help us account for some of the issues we see facing AI. And I'd like to thank the Margolis Center, Dr. Silcox, and the whole AI team for helping me conduct this project over the summer. So I'll be open to questions.
I do have one quick question. So I know you kind of focused your presentation on the first set of stuff that you were working on. I didn't know with the other things that you were doing, if there was something that you wanted to kind of briefly tell us about that kind of second set of stuff that you've been working on.
Yeah, I mean, generally during the summer, in addition to doing the updating the database, I was just kind of helping the AI team out with, we had a workshop earlier this week, so trying to get invitations for that and making sure that went smoothly. And then also helping with copy editing some papers. So it was really great to see what kind of other research was being done in the Margolis Center and helping write things like white papers as well. So that was some of the other work I did during the summer.